And in health matters, the World Health Organization (WHO) has described hepatitis as a silent epidemic, with more than 90 million people living with the disease in Africa, representing 26% of the global total. WHO Regional Director for Africa, Mashidiso Moheti, in a message to commemorate the World Hepatitis Day, said more than 124,000 Africans die each year as a result of undiagnosed and untreated hepatitis, adding that around 4.5 million African children under 5 years were infected with a chronic hepatitis B. Joining us now on the news to shed more light on this is Dr. Nsiabasi Ekanem, a public health physician. He joins us via telephone. Dr. Ekanem, thank you very much for joining us on News Now. Now, first, could you educate us more on this killer disease and help us understand why it's not receiving as much attention as it should?
Well, thank you very much for having me. The viral hepatitis is a group of viruses that attack the human liver. It infects the liver and causes liver damage, which ultimately leads to liver cancer. That's what kills people. It's actually a very, very serious disease for not just Africa, but for the entire world, with a global burden of about 325 million across the world. It is a serious issue, and that's why the World Health Assembly in 2016 described viral hepatitis as a public health emergency of international concern. In that declaration of 2016, the World Health Assembly encouraged or urged member countries to put in enough investment towards addressing, the scourge of viral hepatitis across the world in terms of financial commitment and, of course, regulatory commitment. Unfortunately, a number of countries across the world, particularly in Africa, including Nigeria, have failed, to implement this commitment, even when Nigeria was one of the signatories to this commitment. As a result of that, we are seeing that there is very low access to diagnosis, there's low access to treatment, because most hepatitis patients in Nigeria are paying out of pocket. And of course, there is low access to vaccination. That's why millions of children in Nigeria have not been able to have access to universal birth dose vaccine for hepatitis B.
Sorry to cut you here, Dr. Ekanem, but for want of time now, let's just get your professional advice now on tips and preventive measures against hepatitis.
Thank you. So for prevention of hepatitis, the strategy or the modality here is to adopt healthy behaviors that will reduce our risk of contacting the virus. And the modalities include, number one, avoiding indiscriminate sharing of sharp items. This is one of the ways that we can prevent hepatitis, because hepatitis moves from one person to other when a person who is infected uses a sharp item and another person who is not infected uses the same item, and perhaps there is an exchange of blood through the sharp item. Again, mother-to-child transmission is one way we must help to protect ourselves from hepatitis by ensuring that all children born are given the universal birth dose vaccination. These vaccines will help to protect them from contacting hepatitis even when they are exposed to. Again, we must actually ensure safer sex. So if you are having sex with somebody whose status you do not know, it is important that you use a condom, or as much as possible, you ensure that you get yourself vaccinated, because if you do not, then you may contact the virus. Again, we need to ensure that we prevent child-to-child transmission by ensuring that all children abide by the safety precautions against viral hepatitis. So with this, we can actually beat viral hepatitis. But the most important thing is vaccination, and vaccination is all that we need to do. Everybody must be vaccinated against hepatitis.